My name is Patrice Brown, occupational therapist, employment training specialist. The title of my action plan is the Collaborative Opportunities for Post-Secondary Success COPS Project, an action plan for collaboration of transition services for youth with disabilities in the District of Columbia. Beginning with the problem statement, inefficient collaborations among students, parents, schools, rehabilitation services, and community agencies have attributed to poor post-secondary outcomes for people with disabilities in the District of Columbia. According to a 2015 report by the District of Columbia Department on Disability Services, there are an estimated 40,000 working-age people with disabilities in the district, and only 34% of who are employed. The poverty rate for people with disabilities in the district is at 37%. Almost 10% higher than the national average. The District of Columbia Rehabilitation Services Administration, also known as DCRSA, is the local agency that assists district youth and residents with disabilities with employment and independent living needs in the school, home, and community. A 3-year study concluded that youth ages 14 through 24 with disabilities served by DCRSA declined from 31.3% to 25.9%. This according to the Department on Disability Services. There are barriers to accessing DCRSA services for youth in transition, which include inadequate assessment services, slow service delivery, DCRSA staff not being responsive to communication from clients or potential clients, difficulties completing individualized plans for employment, as well as difficulties completing the application process. The key drivers outlined in the action plan begins with a project goal and a project aim. The goal of the Collaborative Opportunities for Post-Secondary Success, or COPS project, is to implement a collaborative model for system linkages among schools, vocational rehabilitation services, and community agencies for effective transition planning for youth with disabilities in the District of Columbia. The aim of the project is to increase access and utilization of the vocational rehabilitation services and community agencies through collaborative approaches, which link systems to focus their collective expertise and combine resources to improve the quality of transition planning and services for youth with disabilities. There are 3 steps to initiate the project aim. Step 1. Consult with the special education coordinators or directors of student support services to inform them of how the low employment rates have impacted individuals with disabilities in the District of Columbia. And also our roles as educators and members of the transition planning team to ensure students have positive post-secondary outcomes. Step 2 includes identification of special educators, general educators, community service agencies, parents, and students as members of the transition planning team. Step 3 includes the project team strategizing with the transition planning team regarding components and implementation of the COPS project. There are 4 project key drivers. Key driver 1, promotion of general education and special education collaboration. This is done through collaborative models of student assessment, IEP, and transition planning. The 2 parties should collaborate on instructional materials to promote positive school and post-school outcomes. In addition, they should engage in staff development programs such as cross-training, train-the-trainer, or team building. Key driver 2 outlines fostering collaboration between schools, DCRSA, and community agencies or businesses. There are roles that involve the school, DCRSA, and community agencies. On the school's part, they will refer students to the programs or activities promoted by DCRSA or community agencies. Schools will also ensure relevance of DCRSA and community agency activities supporting the students' goals. In addition, schools will help the students use what they've learned from work experiences to inform the transition components of their IEP. DCRA's role will include case management services for job development and job coaching for eligible students. DCRSA will also authorize and facilitate case management for accommodations and supports needed for eligible students to assist them in succeeding in finding work experiences and jobs. In addition, DCRSA will provide funding support when service delivery is established. For their part, community agencies will provide work employment opportunities as well as networking with other agencies and providing schools advice about educational curriculum to ensure students have access to the services that they require, such as health, mental health, human services, and transportation. Key driver 3 includes dissemination of access to a wider array of community services. This would include mapping community resources, developing interagency agreements that promote sharing of information and joint planning, and also ensuring that policies and activities align so that youth and their families can access the various community resources. Key driver 4. This includes establishment of cross-agency evaluation and accountability systems. This is done through assessment of school and post-school employment, evaluation of independent living, assessment of post-secondary outcomes of former special education students, dissemination of surveys after cycle 1 or year 1 to assess barriers encountered by the youth to accessing DCRSA, community agencies, or partnering organization services. And lastly, project modifications may be made based on the assessments and the survey results. Project completion goal. The COPS project will initially work with 3 local charter schools in the District of Columbia, along with the District of Columbia DCRSA, as well as partnering community agencies over a 3-year period. Ultimately, it's designed to first establish the efficiency of the model at the 3 designated charter schools. In the final year of the project, a 1-day institute will be provided at the District of Columbia Public Charter School Board offices to teach interested parties how to implement the COPS model. The institute is designed to encourage additional schools to acquire the capacity to implement the models at their school sites. There are some possible negative unintended consequences. One potential unintended consequence or problem would be continued barriers to access DCRSA services for youth in transition. A strategy to address this would be DCRSA examining ways to engage youth in vocational rehabilitation process by utilizing technology and social media. The agency needs to try to identify ways to communicate with youth using platforms that they are comfortable and skilled at using. DCRSA counselors should ensure that they have an in-depth discussions with transition-age youth about higher education opportunities and that they are exploring the possibility of helping those youth obtain part-time jobs while they go to school. These students need to receive encouragement to apply for the services that are offered by DCRSA, and the counselors should meet them at their school sites whenever possible so that the services can be more easily assessed. Another unintended consequence would be the lack of trained professionals and job coaches and instructional practices to work with youth and individuals with disabilities. Strategies to address this problem might include training professionals and job coaches in evidence-based instructional practices that give job seekers with disabilities increased opportunities of learning to perform vocational tasks independently. DCRSA, community agencies, and businesses should ensure that their internal staff focused on business relations and job development attend customized employment trainings. Another unintended consequence might be the lack of funding for transition services. Strategies to address this problem would be to develop innovative intra-agency financing strategies. Waiver options can be provided to promote cost sharing and resource pooling among agencies to assist students with disabilities in acquiring transition services and supports. Contact local state government agencies that serve youth with disabilities may also be an option. Some states fund transition coordinators whose primary responsibility is to assist districts to help students transition from school to post-secondary education, employment, and community living. Currently, there are 46 states that report employing 1 or more transition coordinators. This according to Johnson et al. In conclusion, there is a definite need to create more collaborative relationships for improved secondary education and transition policies, practices, and systems so that all youth can be afforded the opportunity to achieve successful academic, occupational, and social outcomes. Occupational therapists can have a vital role in transition services and planning for students given our unique skill set and expertise in work and task analysis, behavior and psychological needs, sensory processing, technology, and independent living skills. My experience as an occupational therapist and transition specialist has been rewarding as I've been able to not only advocate for the students to ensure improved service delivery, but I've also been afforded the opportunity to increase school staff and my colleagues' awareness about helping students with disabilities and the expanded role that occupational therapists can have in the school setting. Completion of this project has certainly led me to conclude that there are many challenges associated with transition services. And in order to make gains in secondary education and transition planning, there has to be a commitment to educating all invested parties and promotion of meaningful collaborations at all levels. Lastly, here are a list of references that I utilized in completion of the action plan project. Thank you for taking the time to listen to this presentation.